The report.
This particular article is about, about 2 articles.
Okay, what were the articles about?
The articles were, I first saw it on the Metro. It's about, again, it doesn't tell us about what happened before, but it tells us about these senior members, the senior high-level MP. I don't know if it's a minister. I need to be sure about that.
Senator.
It's the senator. Yeah. What he says, he says women should. Yes. Yeah. He says women should go unwashed. Families in Zimbabwe should be limited to 1 sexual encounter in a month.
That's another member of parliament now.
No, it's the same. It's in the same report.
It's in the same report, but the person who's saying it
is another member of parliament.
Is another member of parliament.
Because it's a debate, isn't it?
Yeah.
And then the female, the circumcision for women, again, which is female circumcision. And then I know that there's another member now of parliament, a female senator now, who has the perception, that there's nothing women can do to stop their husbands from going out. But married women should negotiate to know their husbands' mistresses. Again, for me, that, is the blame now going towards who are the mistresses now in this context? Definitely, in her mind, the mistresses are not the married women. The mistresses may be the single women, it could be widows, whichever, but they are the women who don't have, and it is unfair, to lump that on this group of people, because amongst this group of people, you have some of the most hardworking people, but outside that, you have some people who are victims as well to the situation. And if you look at the situation, what if some of the mistresses are not actually women, they are men? What if, again, those gender, the debate on gender comes in this whole thing about HIV management, HIV provision, HIV prevention, and so on, again, which again is unfair because we know that it's working collectively that will actually help us to address this. It's a devastating thing. I mean, it's gone beyond the level where I blame you or you blame me. There's no need for that anymore. But how do we make sure that the next generation is clear of this situation? It's about working together. So I'm really uncomfortable about this stage of the debate.
And then another thing that I've noticed reading the reports is that the people who are saying these things are all members of one political party.
That's right. Oh, again.
Yeah.
Yes, you say.
Yeah.
Aha. So you say political balance again with that.
What do you think is happening? Why do you think that is so?
The ruling government, is it? Is it the ruling party?
It's not.
It's the opposition party, is it?
Yes.
So could they be misquoting?
They are saying it in parliament or in parliamentary workshops. So if they were misquoted, chances are someone will pick it up, there and there, and say, no, look, this is not true. This did not happen.
Yeah, but they are not challenging it.
No.
So what is happening then?
I have no idea. How do you think
the message can come up? Yeah. I think the key message that we need to give is acknowledging the fact that a lot has been done to mitigate HIV in Zimbabwe, but also around the world, and to challenge the perception that by treating women, discriminating against women, or by oppressing women is one form of oppression, you know, it will actually help the situation. But we encourage working together, as has always been, to raise awareness, to help with people to have to go in for testing. That's raise awareness, get people to test early, and get people to have the right treatment. I think so, I don't know, but that's what I think. And what do you think?
So that is what the members of parliament and the senators should be saying.
Yeah, I think that should be the key message, isn't it? You know, to continue to support, to ensure that people are tested, people have the right medication, people have the right support, the right awareness level, so that we can continue to reduce the spread.
You also say that you know, a lot has been done. What do you mean?
What I mean is from other articles again, because if we are saying, looking at some of the articles that have come from the same this thing, it talks about HIV level, the spread. Is it HIV related death, or the spread has gone down in Zimbabwe? That's what they say. You know.
Why do you think that is so?
I think that would be Zimbabwe, but I'm just thinking around generally. I think the first thing is because communities, the people in the grassroots, they are strong together. I also think that because there is more access possibility, that there is more access to testing and maybe treatment. We're not saying it's perfect, but that there is more than before, and there's more awareness about HIV, what HIV is, what HIV is capable of doing. So more people, you know, more people are becoming aware of how to either manage their health in the case where they are, or more people are being more conscious about their sexual health.
I know you've talked about this, but what is the problem with what Morgan Femai is saying?
The problem with what Morgan Femai is saying is shifting the discourse on HIV on women, you know, because he seems to have a blind eye on the responsibility of everybody in preventing the spread of HIV, because he alludes to women, because he goes towards women, to do the let our women be, women this and women this. It doesn't mention about what happens with the men. So his perception is, if we get women in order, and this is the hotline that I'm placing on them, then men will be safe, then the society will be safe. So it's not a very, very good statement to make. You know, especially at this stage. We know that there was a stage where the whole thing about HIV about 20 years or more is this person. We know it's still going on though. You know, it's black men, or it's black women, or it's gay men, or, you know, it's African people, and so on and so on. But that didn't actually help to curb down the spread of HIV. What helped was people working together, you know, learning together, crying together, you know, that did help in the grassroots, and then with the political will of politicians to enable communities to access different kind of services related to HIV and so on, which did help in my opinion.
What should Morgan Femai be saying?
What he should be saying is I think what he should be saying is about better sexual health for everybody, more access to a treatment, more awareness, more access to community testing, to testing facilities, which will lead to prevention and, in the long run, the elimination of the disease. So it would promote a healthy sexual health, whether by condom use or by abstinence, which is a key for those who cannot condom use, healthy sexual lifestyle, fighting against stigma and discrimination. Because why does a husband fear to tell the wife about it? Why does the wife fear to tell the husband? It's the fear of stigma. It's the fear of discrimination, what the society will do to me, what they'll do to me. But if people understood that by telling each other is to empower us both, to manage the situation, then people will do. Because I'm sure that if a husband has diabetes or something, will share that with the wife, or the wife has it. So the whole issue of HIV is a problem. Why? Because of the perception that has been linked into it. It's infidelity, it's promiscuity, it's all of those these things. And I think that is what he is trying to address. He's looking at promiscuity. If we address promiscuity, which is women, then it will stop. That's the way it comes across.
Does what he's saying add to or reduce the stigma associated with HIV?
He doesn't even think about reducing it. I think for him, this thing will stop. If this thing has to stop, then let's get women, let them be less attractive. Let's reduce the number of times that families will have any sexual encounter. And definitely, when he's talking about that, I'm not sure he's thinking about himself, his wife, or his family, his children. I'm not sure it's the other person. It's that not in my backyard kind of attitude, which you see a lot with mental health. It's not me, can't be me, can't be any member of my family, it should be him, it should be her. It's that kind of other person, but with HIV and any other illness, it shouldn't be the other person, it should be all of us. It's the health of the community, it's the health of the local, the global community. So we don't have to, it doesn't have any social class or boundaries. So I'm not sure that he is thinking of himself or of any of his children. I'm not sure. He wouldn't prescribe a circumcision for his children, because definitely in his mind, my children cannot, or my wife cannot, or my sister cannot, or my mother. You will not think of my mother cannot. But when I think what the senator has done is sympathizing and not empathizing. Because when you enter empathize, you put yourself in the shoe, and think, oh my God, if this is happening to me, oh, okay, I don't know, but these children are growing, my children, you never tell with children, you don't know what they, but I could be sick and in the hospital, or something could happen in this life. We all just place our faith and our hope, If he thought about that, I'm sure his message would be